the message is, if you can link data between an opinion on something to more information about the disease, because you've got the clinical records, you've got what we call linkage, you've got much greater opportunities to take the ideas forward, to develop them, to see whether or not there's something that when you probe it, you can go forward. And so PSC Partners has this opportunity because of its registry. It's not the only registry in PSC, but it's a very powerful registry because it's patient-led, to say, okay, well, this is what people said, but actually, because they took it through our registry website, through our platform, we can, if you're interested as an investigator or as an interested patient or as an interested industry or an interested regulator, we can actually say with more certainty, this wasn't just random people who we think have PSC. We know they've got PSC because they provided their clinical information. We know more about where they are in their journey with PSC. Is it pre-transplant, post-transplant? Is it very early disease? Is it childhood disease? Is it, you know, later in life disease? And that really then says how you might design the next study, how you might go about doing the next study efficiently and effectively. And I guess what you're hoping to be is always a catalyst, because nothing in research is easy, but you're hoping that, you know, because we have a global audience, there are lots of bright people around, lots of smart patients, lots of smart investigators, lots of smart trainee doctors who have good ideas. And some of those ideas don't need much financial resource, they just need access to data. And you might be the catalyst. They might say, well, that's a really great question. I actually saw that in clinic, and now I hear it from your Voices survey that actually other people have said the same thing. I'm actually quite interested. How can I take this forward? And, you know, the truth is that, you know, particularly in academic worlds, we live in ivory towers, but the more people we have thinking about PSC, the more good ideas, the more likely that one of those ideas is going to impact what we actually want. So we're not in the business of closing the door to good ideas. We should be in the business of opening as many doors as possible.